from the sublime to the ridiculous is just a small pace. This is quite narrow. Now, when you've had your surgery and your pain has hopefully been coped with, or you've had your wonderful anaesthetic treatment and your pain has been coped with, the problem is that if your body hasn't been working for the last few weeks or months or years, you won't actually have any muscles left. If you have pain in a muscle group, for various reasons, you'll lose up to 25% weak. And the muscles will respond to you trying to exercise them by going into spasm, which in turn kicks all the central pain systems into working. So one of the most important things is trying to get people fit from very low levels of energy to start off with. Now, Frederick the Great hit upon the idea that it was a good idea to exercise, and he took this very much to heart and spent the next 40 years exercising Europe, probably one of the least graceful people to these are some of the boys warming up. Now, the warm-up is really quite important for people who are quite weak, and a heart rate monitor can be extremely helpful if you're doing it. Now, whether you warm up or not within 2 or 3 minutes or 4 or 5 minutes or 10 or 15 minutes depends on things like ambient temperature, water vapor pressure, how your autonomic nervous system is feeling, which also goes wrong in these things. And if you have a patient that's having real problems and you get them a heart rate monitor, get them used to seeing what their heart rate does. If their heart rate shoots up as they start to exercise, that tells you that they're pre-tired. So at that point, they want to do about a third to a half the exercise they were thinking of doing on that day. Remembering what the brain is measuring is effort, not what you actually do. So you'll get the same value as far as your fitness is concerned if you halve the exercise. And the problem that we have with patients like this is they tend to go over the top, knock themselves out for several days afterwards, and then they'll stop exercising because their pain levels get too high. The other thing to be aware of, particularly in younger people, is if your heart rate starts to buzz up and down 10 or 15 points or so as you're exercising, that may mean that you're carrying a virus which is going to cause problems of which you may not be aware. And one of the commonest causes of sudden death syndrome in athletes is that they're carrying a cold virus or something that they're not aware of. And if you're wearing a heart rate monitor when you warm up, you'll spot that problem. Here are some of the boys exercising the Austrians, who are a rather too gemütlich load of people, and that gets rid of the Oberschlag. Resistance work is about weights and developing power. That's instantaneous energy download in muscles, and I'll get on to the problems with that later. This is a rare colour photograph of Frederick the Great's favourite dogs. You can tell they're Prussian because they're standing in a line, and he was very fond of greyhounds. But cardiovascular exercise is what gives you the endurance in the muscles. So I'm breaking this down into very non-complex areas, but essentially the corrective work is what teaches your brain to select the muscles that you want to use, remembering that our bodies are spending most of their time trying to switch us off to save food. So in a normal person, about half your muscles are dormant, probably up to about 70 or 80% are dormant in a chronic pain patient. And then resistance work is about developing the explosive power in your muscles, and essentially the more male you are and the more squarely built you are and the younger you are, the more your muscles are genetically going to respond to that. And the slimmer you are and the more female you are and the older you are, the less you're going to get any response to that. And cardiovascular exercise is about building endurance in those muscles which have been woken up by the central nervous system. Throughout time and history, people have set upon the idea that it's a good idea to get your core muscles working and get your central nervous system tuned. So there are numerous ways of working, and you'll find that all the old martial arts routines, all the old dance routines, all these things like the technique and Pilates and yoga are all good core stability exercise. And a really good person from any of these disciplines can actually teach people how to use the central parts of their brain to get things working. In my opinion, if you've had musculature which has been in trouble for a long time, unless someone gets their fingers in it to get it moving, it's never going to move properly again. So it's important that people have soft tissue mobilization and massage skills as well as this. And they need to be careful about picking up on when people go wrong, because unless you're constantly watching people who've had pain for a long period of time, it's very easy for their brain to flop back into using the musculature in an abnormal way, and they simply won't learn. If you've got a really complicated patient who's been in pain for a long time and the whole of their central musculature is switched off, the thing to do is to start just above the pelvic rim and then work your way out into the other areas. Now, it may be that the patient comes along to you and says, well, mainly neck pain, but that's not going to get better unless you get the rest of their skeletal structures working properly. So sometimes you have to guide people away from where they're feeling the pain to actually get them to exercise areas which to them appear to be unrelated to the problems that they're actually having. And that's where the psychology kicks in, and it's very difficult to bring people along with you. The snags with this are, this sort of thing is extremely operator dependent. You have to have the right person, and in pain states that may mean that the person delivering the service has got to be psychologically attuned to the patient, able to deal with patients with chronic pain states who are often pretty grumpy and unpleasant individuals to deal with through no fault of their own. As people start to move better, their pain levels won't necessarily fall. So in my NHS practice, where I have to waste as much money as possible by measuring everything, we measure about 4 measurements of people's physical ability and about 10 measurements of how they feel about everything. And in the people who are responding to the pain management program, you find that you can show that the 4 or 5 measurements of the physical ability are going up, but they all do a psychological nosedive at about 3 months into the program, because their pain levels remain much the same, because the pain is still reverberating centrally in the pain system. So every time one of their muscles in the original domain of their pain falls over or has a little tweak, their brain will play them back an identical message of the previous pain, because that's what's stored. So to them, they're not getting better. And this is where the psychology comes in keeping people on the straight and narrow. It's very easy for patients, if they're not properly looked after with someone really looking after them, to develop exercise creep, where you'll develop all sorts of little tricks for taking the strain off the area where you're trying to do the exercise, or you'll get the sequencing wrong. And because it takes a long time to work properly, and if you're really going to get after it, requires oriental levels of concentration where you work very, very, very hard, at least initially, for what appears to be quite poor returns. Resistance work. As I say, this is about developing powerful muscles, and it works in different ways, but it switches the genetics of the muscle on so that you're getting more fast twitch fibers. It changes the way that the brain is talking to the muscle so that it kicks in faster. And in people with the right genetics, it will increase muscle bulk. And in people who are taking the right substances, it will increase muscle bulk, but not in your calf muscles, which is why people like Arnold Schwarzenegger always wear large boots to cover that up. And it makes people feel good. You feel toned afterwards. So people like doing this sort of exercise. But in modern life, it's probably actually not as important as that. I mean, being powerful was important when you had to strangle your own sheep, pull your own trees up, things like that. But we now have machines that do that. And if you're doing it incorrectly, and if you go into any gym anywhere in the UK, you'll see people doing bizarre things with weights, like lifting them up and then just flicking the wrist up at the end. And of course, you then get fatigue injuries to the common extensor origin with that. And the interesting thing about fatigue injuries is they can go at any point. So I've seen people do that for years, and then they walk past a water cooler and their common extensor origin explodes. And they say, where did that come from? But remember that muscle structure is microcrystalline like metal, so it fatigues like metal, will again just suddenly go for no apparent reason. It's easy to do what's called trash exercise. People know about trash exercise? No? We'll give it blank. Okay, I'll come on to trash in a moment. And as I say, people really enjoy it because you feel good afterwards and you feel the circulation and everything else. And in some subsections of the population, particularly slimly built, hyperflexible girls, it just doesn't work. I mean, these girls just find it very, very difficult to build muscle at all. So it's really actually a very limited use if you're trying to get someone better from this sort of problem. Cardiovascular exercise. Now, in the natural state, what's supposed to happen is that by the time you reach 25, you should be able to run about 70 miles in a day, about 6 miles an hour cross country. And the way that the brain controls this, because the brain is actually controlling all these things, is by using the pituitary gland to produce growth hormones. So up to about the age of 25, we're all swimming in growth hormones. So young people have very good recovery times, even if they're not terribly fit. But over the age of 25, the brain switches the growth hormone off, and then what it's doing is measuring the amount of cardiovascular exercise that you do during the day and giving you enough growth hormone to make up for what you do in that day. So we talk about heart rates and training zones and things, but what it's actually measuring is various chemical distress markers coming from various parts of your body. So if you run 30 miles in a day, you get 30 miles worth of growth hormone. If you sit behind a computer all day, you don't get any growth hormone. So, and if your level of exercise is below a certain level of distress, your brain doesn't register that as exercise. So that's where the trash exercise comes in. So all house care, child care, travel to work, sitting at work, husband care, shopping, all the things that girls particularly do a lot of is trash exercise. So they're busy, 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 but all that's going to do is tire them and actually stop their body responding to the exercise program because they're not getting this growth hormone response that we want. So this again is where the psychology kicks in big time in dealing this, because you're actually having to completely start to mess with people's lives and the way that they've lived for years in order to get them to pull back hard enough for this system to work. So once you've got your growth hormone, what that does is then give you a cadence release of every other hormone you've ever thought of. So the insulin system is in there, the ACE system is in there, growth factors 1 and 2 are in there. This is what all the athletes are playing about with by poisoning themselves with insulin. And the thyroid system and the sex hormones are in there. And this cadence release targets the muscle DNA to make it print out the extra protein systems to give you the extra energy-making capabilities, but only in those muscles that have been pre-selected by the central neurophysiology. So if you don't get your corrective exercise right, you'll never get the muscles that you want actually fit. So it's really important to get that system of muscle sequencing working beforehand. But also the converse of that is if you've got thyroid failure or you've got diabetes or pituitary gland failure, or you're on protein blockers or ACE inhibitors, or you're on a beta blocker which stops your heart rate going up. There are all sorts of medical things which will actually stop you responding to the exercise. So it's important that, you know, as a doctor, you look at things and see if you can play around with them. And although the hormone replacement works for keeping you healthy, it doesn't work as well as it should do for getting your muscles to respond. I had a colleague who was ex-service and had a pituitary gland tumour and wanted to run the London Marathon, and I said rather stupidly that I would help him with doping the system for him. And I used the initial stuff that you're meant to use and nothing happened, and I think I ended up giving him about 10 times the amount that I should do it. I got him round the marathon. He was hideously fatigued afterwards for several months, so I was obviously left something out of the mix. But as I say, the replacement doesn't work as well as your own stuff. Different levels of intensity of the exercise pick out different parts of your body. So at a low level of exercise, essentially we're using mainly the core muscles to work. And then as you go faster and faster, by the time you're running, you're almost gyroscopic in that it's just the external fibers on the outside of your body that are actually moving at that point. And the refeeding process is incredibly focused on what you've been using. So if you get someone going into a gym and exercising at a heart rate of 160, 170, they're turning themselves into an insect. They're only just going to get fitness in the outer skim of their body, and their core again is never going to respond to that. So when you're starting people off, keep the heart rate nice and low, 100, 120, no more than that, then you'll be favouring the type 1 fibres in the core muscles. You get fit for precisely what you do at precisely the time of day you do it and precisely the intensity you do it. If you deviate 10% one way or another, the body will use 100% more substrate to give you that peak in energy level, so it will tire much more quickly. The other thing to be aware of with the cardiovascular exercise and the endurance is that the body has its own biorhythms of energy production, some of which are on a 3-week cycle. And the defensive enzyme systems are on a 10-day cycle. So just as an example, have you heard of things called heat shock proteins? These are the things that protect you from heat stress. When I was in the services, all the people I saw that died of heat shock had already had an episode of heat stress 4 or 5 days beforehand, which they'd walked through. They felt fine. But they'd used up all their heat shock proteins. So when they next met the heat stress, there was no defensive system in the body and they just cooked instantly. And the same is true of superoxide dismutase and all the other defensive enzyme systems. So you'll get a patient come along and say, great, I've done this, I've really cracked it. And they try the same 5 days later and they fall over, and you have to gently get them through that, because it's really just a vagary of how their muscles are working. And again, because you've got all these different peaks and troughs going on at different times, it's not just what they've done over 1 or 2 days that's important. The body is actually reading over about 3 weeks. So it's a bit like Antarctic exploration. You die on day 21 of what you did wrong 3 weeks earlier without realizing that was an irredeemably fatal error. So that's another way of explaining to people these good and bad days that they get and keeping them through that. And that's why pacing is so important, because what I say to them is, if you're having a really good day and the temptation is to cram all the stuff that you haven't been able to do into that day, try and do about half what you think you can do, and then you won't crash 3 days later. Again, you get, if it's a very good idea to mix what you're doing so that you get a mix of things and not just concentrate purely on the swimming or the cycling or these other things. And remember, as an animal, we're designed to walk and run, so that's actually a good exercise if you can. Overtraining is a problem with some people. I've talked about the chronobiology. When people tend, because they're busy, they tend to back-to-back their exercise, so they'll cram in 2 or 3 sessions over 3 days. And what we see from the scientific papers is it's best to do it about 3 times a week with a day in between if you can, unless you know exactly what you're doing and you can exercise different parts of your body, which is what the athletes are doing. If you find that people are not progressing with your exercise program, there are 4 areas that you need to look into. The first one is, have they got a medical problem like the medication or something else which is stopping their body responding to the exercise? The second thing is, have they screwed up the exercise program? Are they doing something wrong, as in this list here? The third thing, and this is very common with most of our city patients, is they're heavily overpaced by their work and family commitments, and their body is not going to respond to the exercise unless you take the workload off them. And then the fourth area is, are they subsumed by some ghastly psychosocial situation which is going on, which is taking all their mental energy and stopping them exercising? And people can be very difficult to spot on that, particularly people who are into drink and drugs, and particularly the topper-uppers, the people who start the day fairly drunk and then just gently top up all the way through. They can be extremely difficult to spot. And the other group who are very difficult to spot are the bulimics, because they've got a normal body weight, but in fact their metabolism is in chaos. Because so you need to start looking in those areas if people aren't doing as you would want. So having whizzed through that, you can now have a rest before my learned colleague talks about surgery.